Welcome back to Minority Med Project, where we discuss minority health, representation in medicine, and the issues shaping healthcare in our communities. Today, we're untangling two terms that sound almost identical but play very different roles in our well being: healthcare and public health. Most people use these terms interchangeably. When we think of healthcare, we usually picture doctors, nurses, prescription medication, or visiting a hospital. But while healthcare focuses on treating individuals after they fall ill or get injured, public health works behind the scenes to keep entire communities from getting sick in the first place. Understanding the differences and how the systems interact is essential for advancing health equity in minority communities. To break it down simple, think of healthcare as reactive and individualized, while public health is proactive and population focused. Healthcare is centered on the one on one clinical encounter. A doctor diagnoses your specific illness, orders a blood test, prescribes a treatment plan, or performs a surgery. It addresses your immediate physical or mental needs in a clinic or hospital setting. Public health, on the other hand, steps back to look at the bigger picture. It asks, why are people in a specific zip code getting sick more often? Public health initiatives include clean water regulations, fluoridated tap water, restaurant safety inspections, neighborhood vaccination campaigns, seatbelt laws, and anti-smoking messaging. Instead of treating one patient at a time, public health protects thousands or even millions of people simultaneously. A classic analogy in medicine explains it best. If people keep falling into a raging river, healthcare is a team of doctors downstream pulling individuals out of the water and giving them emergency care. Public health is a team walking upstream to figure out why people are falling in, fixing the broken bridge, and building a fence to prevent anyone else from falling in to begin with. Why is this distinction so vital for minority health? For decades, investment in the United States has heavily favored downstream healthcare over upstream public health. We spend trillions of dollars on high tech medical treatments, while public health infrastructure like disease surveillance, local health departments, community health workers, and environmental monitoring remains underfunded. This imbalance severely impacts minority communities. When public health fails upstream, when neighborhoods lack clean air, access to fresh food, fluoridated water, or lead-free housing, rates of chronic conditions like asthma, diabetes, and heart disease skyrocket downstream, like we've mentioned before in this podcast. Simply building a hospital in a community doesn't solve the underlying environmental and systemic conditions that cause disease in the first place. To eliminate health disparities, we need both systems working in harmony. We need strong, accessible healthcare systems, staffed by diverse and culturally competent providers who can treat illness when it strikes. But equally important, we must invest in robust public health policies that clean up our environment, address social determinants of health, and protect communities before a crisis ever occurs. When we strengthen public health upstream, we build a healthier, more resilient community that need fewer emergency interventions downstream. Thank you for listening to Minority Med Project. Join us next time as we continue exploring the topics that shape minority health and the future of medicine. This is Minority Med Project, educating, uplifting, and inspiring.